Hi, my name is Dr. Sher. I'm a board-certified orthopedic surgeon, and I'd like to talk today about a common orthopedic finding, meniscal tears. It's one of the more common reasons for visits to an orthopedic office, but I'd like to talk about a typical workers' compensation patient who has a knee injury. So if we take a typical 45-year-old employee who may have a trip and fall and they land on their knee, the common course of treatment might be that they would end up at an occupational health center. They may get some x-rays that show there's no fracture. They may or may not have some bruising along the knee, and a diagnosis that would be consistent with a contusion. So they get treated appropriately, which might include some anti-inflammatory medications and a few sessions of physical therapy. Typically what happens, the patient will come back and complain of continued pain. An MRI will be obtained and it shows a meniscus tear. They end up at the orthopedic office, and all too often these patients will end up getting surgery or arthroscopy of the knee. Just want to caution those that are evaluating these patients is that not all meniscus tears require surgery. If we put the meniscal tears into different buckets, we can place them into two large buckets. One would be an acute traumatic type of meniscus tears, and most of those patients typically do require surgery. And then there's the other bucket, which would be degenerative tears. If we start with the acute traumatic tear, typically it'll present on MRI with disruption of the meniscus across the grain of the meniscal fibers. There could be separation from the capsular wall or the periphery of the knee joint, or there could be a complex tear pattern which may involve tearing the meniscus in multiple planes. Typically we may see, if it's an acute injury, a surrounding zone of injury, meaning some edema or injury to the surrounding muscles, ligaments, and or bone. Those patients may also have mechanical symptoms where the knee locks or gets stuck. Those patients typically have a mechanical problem with the knee and often will be best served with surgery. The other category of degenerative tears typically will present with a horizontal pattern described on the MRI report and also visible on the MRI films. Those tears have surrounding degeneration as opposed to acute trauma and zone of injury like in the acute category that I just briefly mentioned. The surrounding degenerative changes around a degenerative tear might include chondromalacia or thinning of the cartilage, fibrillation of the cartilage. There may be surrounding osteophytes, all consistent with arthritis. Typically you won't see that zone of injury with edema of the bone, muscle, or ligaments surrounding the tear. It's been shown, and there's been conclusive studies, that patients that have degenerative tears do no better with surgery than they do with physical therapy alone. And sometimes taking these degenerative tear patients to surgery does not serve them well, in that you run the risk of increasing their symptoms and potentially prolonging their overall care and possibly requiring additional surgery. So the message here is just to be vigilant of the different types of meniscal tears, and knowing that not all meniscal tears require surgery, and many can be best treated with physical therapy and conservative care with return to baseline and back to their normal life and employment. Thank you.